So why is it necessary to test someone's metabolic rate?
Well, traditionally, clinicians have used predictive formulas to determine how many calories a patient needs, whether they want to lose or maintain their weight. But metabolic rates vary significantly from patient to patient, and studies show that even the best formulas are off for 40% of the population.
So how does this translate into patient care?
Well, consider this sample of actual female patients tested by Dr. Robert Kushner at the Northwestern Obesity Clinic. As expected, 60% of those tested had resting metabolic rates that were plus or minus 200 calories of what was predicted by formulas. But 30% had RMRs that were lower than predicted. If their calorie goals had been based on these formulas, they would have actually gained weight. One woman's RMR was so low, she would have been eating in excess of 700 calories a day. What about the 10% at the other end of the spectrum? Even significantly underestimating caloric needs can be a problem. If the doctor has unwittingly made more drastic calorie reductions than intended, especially during maintenance, the patient may be thrust into a state of deprivation, and the next thing you know, they've fallen off the wagon. Even those who are considered normal will have varied results, because plus or minus adds up quite quickly in terms of calories. Consider being on the wrong end of that 200 calories a day error. In 1 year, that adds up to over 20 pounds. So statistically, some patients will gain a little, some will stay the same, and some will succeed. When you see numbers like this, it causes you to wonder, why would you ever put your patient's success to chance? An actual measurement of their caloric needs is the only logical path to long-term success.